RFK Jr.'s been caught in a lie, and I have the receipts. Just today, it became public that he sent a letter to Congress with the evidence behind repealing the recommendation that pregnant women should get a COVID vaccine. In that letter, he said, quote, "A number of studies in pregnant women showed higher rates of fetal loss if vaccination was received before 20 weeks of pregnancy," and then he had a little citation marker to reference study number 8. Unfortunately for Kennedy, I actually looked up and read cited study number 8. The title was Miscarriage After SARS-CoV-2 Vaccination, a population-based cohort study. I literally think that Kennedy stopped there after reading only the title of the paper, not bothering to read the actual results, because the results showed the opposite of what he claimed. In the abstract of the study, right at the top, it says very clearly that SARS-CoV-2 vaccination was not associated with miscarriage while accounting for the competing risk of induced elective abortion. Going past the abstract, we can look at the actual data in the paper. While we do so, keep in mind that this is the paper that Kennedy cited to Congress to justify his claim that COVID vaccines increase risk of miscarriage as part of removing the recommendation for their use. Here's the big finding in Table 2, SARS-CoV-2 vaccination timing and associated risk of miscarriage. The hazard ratios are shown over in the right column over there. That first row is for unvaccinated individuals, unvaccinated pregnant women. So the reference rate of miscarriage is 1.00 because that's the comparison group. If the vaccination group did have a higher rate of miscarriage, for example, if there was a 20% increased risk, that would be a hazard ratio of 1.2. But that's not what happened at all. The second row shows the hazard ratio for pregnant women who were remotely vaccinated, which they defined as being vaccinated more than a month prior to conception. There was no difference in the risk of miscarriage there compared to unvaccinated pregnant women, with a point estimate of 0.98, and you can actually see the hazard ratio crosses over 1. It says it's somewhere between 0.91 to 1.07, which means there's no statistical difference in miscarriage rate compared to unvaccinated pregnant women. Similarly, the third row shows people who were vaccinated either just prior to conception or up to a few months after conception, and again there was no difference in miscarriage compared to unvaccinated pregnant women, including after accounting for different rates of induced abortions with the different groups, with a hazard ratio of 1.00, the estimate ranging from 0.93 to 1.08. Zero statistical difference. So to be clear, this cited study showed literally zero estimated impact of COVID vaccination on risk of miscarriage. Is this the gold standard science he's been promising us? Citing papers that are the opposite of the claims that you make? For the record, the rest of the actual medical literature shows an extremely clearly supportive benefit-risk ratio for COVID vaccines during pregnancy, dramatically reducing risks of complications of infection for both the mother and for the child. The Director of Communications for Health and Human Services, speaking about this letter to Congress and this evidence, they said there is no distortion of studies in this document. The underlying data speaks for itself. It raises legitimate safety concerns. HHS will not ignore that evidence or downplay it. We will follow the data and the science. You fool, there is no war in Ba Sing Se.